Hello, in this video series I aim to provide you with an updated version of the key concepts you need to know so that you can easily master and be successful in the medical or doctor job interview. Hi, I'm Dr. Anthony Llewellyn, the career doctor, and I'm an experienced medical HR expert and interview coach. In this lesson, we're going to talk about the most common question type that occurs in 90% of all medical job interviews, the why you question. So in this video, I'm going to answer the question, what is the why you question? What are some of the different formats it comes in? Why is this question asked? And how can you help both yourself and the panel by providing the right information to suit this question by using a model framework for answering this question? So typically in a panel interview, the panel will want to ask a fairly broad opening question first. And there are a few reasons for doing this. Firstly, they want to help ease you into the interview by giving you a question that you've hopefully prepared for. Secondly, believe it or not all panel members have bothered to or had the time to review your CV and application in depth. So an about you type of question helps them to get a snapshot of who you are. And thirdly, and most importantly, most panels want to cut to the chase and hear about how you can meet their expectations in terms of the selection criteria. So a couple of points here. One, if the panel is going to ask you a why you question, it is generally going to be the first question. It doesn't really make sense to ask this question later. Two, they don't have to ask a why you question, but they generally do. I would say about 9 times out of 10. Three, even if you are in an MMI interview, there's likely to be one or more occasions where you'll be asked to talk about your strengths and suitability for the role. So even if you don't get asked this question in the interview, it's a pretty important question to be able to answer for yourself. If you cannot say why you want the job and why you should get it, you probably should not be bothering with the interview. So let's talk about the trick to this question and the secret to a successful answer. The trick to this question is that it can be asked in a variety of forms, which may seem different on the surface. So here are a few ways I've heard this question be asked. Tell us about you, which is my least favorite version as it lacks specificity. Tell us why you're interested in the role. Or tell us why you've applied for the job. Now, these two sound like they want to hear your reasons for applying. Whereas, tell us how you've prepared for the job, or tell us why you're a good candidate for the job, and what strengths do you bring to the role sound more like they want to hear about your skills, experience, and qualities. So that is the trick. The question can come in a variety of forms, and you don't know what that's going to be exactly. Regardless of whether the question is about your interest in the position or the skills you possess, the secret to successfully answering this question is to talk about both things. So you can use the CAMP model, C-A-M-P, to develop a model answer for this question. CAMP stands for Clinical, Academic, Managerial, and Personal. So clinical is obviously the clinical knowledge, the experience, the skills, etc. that you bring to the role. Here I suggest you think about what makes you unique as a candidate versus all the other potential candidates that are going for the job. So if you have more experience, talk about your experience. Or if you can do more procedures and it's a procedural post, talk about these. Academic is about your own learning, as well as your ability to teach others, as well as your research and scholarship. So think again about what they're looking for in the role. For example, if it's a consultant role, they're probably looking for someone with the ability to teach trainees and medical students. So talk about your experience and success in this area. Next, management. Now, some doctors struggle a little bit with this term, so if it makes better sense for you, substitute my other skills. Again, look at what else is in the selection criteria and try to talk about some leadership or administrative or other non-clinical skills or achievements you have had that relate to the post. Success with quality improvement projects is a popular choice for this section. Finally, personal. Now, if you read other advice about CAMP, this is where you might talk about your personal qualities that you think are also relevant to the role. But what I'd encourage you to do here instead is give a personal story about what it is that you like about the job and why it is that they should have a good feeling about you being employed in it. So far, you've given the panel a whole lot of logical reasons to employ you. So now you need to give them an emotional hook for them to think that you are the ideal candidate. It doesn't have to be an elaborate story. Classic examples would be that you've worked at the hospital before and you really enjoyed the support of the team. If that's the case, tell them about that. So a final couple of points before we move on to our next question type. Firstly, now that you have your model answer to the why you question, you do really have to practice giving this answer to the different versions of this question so that it comes across naturally in the interview. Secondly, we are attempting to accomplish a lot of things in this question in an answer. Primarily, we are trying to demonstrate that you bring value to the role, that you can transition seamlessly, and that you will be grateful for the opportunity. That is quite a lot to accomplish in one answer, so don't worry if you can't do it all in the first answer. It's better to not overload your answer with too much content. You will have more interview questions and opportunities to add to this first answer. Now, if at any point you feel that you've gotten value out of this video series and want to dive a bit deeper into mastering the doctor job interview process, then I highly recommend my Doctor Job Interview Skills course, where I do a much deeper dive into each of these question types and a lot more concepts to help you truly excel in the medical job interview. For example, in the course I go over in a lot more detail what the panel wants out of the why you question and how you can signpost or introduce your answer to this question. If you click on the link in the description or at the end of this video, you can purchase this course for a special discount just for watching the whole way through this video. And I'll see you in the next lesson.